All right, YouTube says it's preparing.
Yeah, I have a notice that it's now streaming live on YouTube.
Okay. Yep. Okay, we're live.
Okay.
Great.
Good morning, everyone, and sorry for the slight delay here. Technical difficulties. We appreciate you hanging in, and we think it's going to be worth your while. My name is Dan Nolan. I have the pleasure of serving as president of Hugh Johnson Advisors. And this morning, we have a really terrific group of people to walk us through our first and what we hope are several sessions on restarting our economy. I'd like to start by thanking our partner, the Times Union, who is co-sponsoring these sessions with us. And we'll have shortly an introduction of the panelists. Let me tell you first what we think we're trying to accomplish here. We've just experienced a very unique event in the history of our country. We closed it. We closed the economy, and therefore we closed many businesses. Now we're going to face another novel event. We have to restart America, which means we have to restart many businesses. There's no playbook for this, folks. There's no glide path that anybody lays out to tell us how we do this in the face of what is a health pandemic. But we do have to do it. And so we came together, and our thinking was, this is going to be a lot easier if we do this together rather than if individually we try to fight our way through this. So we've scheduled a series of sessions, starting with today's on safety in the workplace. Next Tuesday, the 5th of May, access to capital. The week after that, May 12th, human resource issues. And the week after that, reinventing your business model. That's May 19th. None of us can possibly know what the future will hold, but I think we're going to be better sharing our thoughts and our solutions, thinking through our challenges together. So with that, I'd like to introduce a man who needs no introduction, Hugh Johnson, my partner, who's the chairman and the chief investment officer of Hugh Johnson Advisors. Next week, Hugh is going to provide us with his forecast for the economy, but we thought that to set the table today, Hugh would give us just a snippet of his view on what we might be facing in the economy. And so I'm going to turn it over to Hugh for a few minutes on a 30,000-foot look at the economy. Hugh?
Thanks very much, Dan, and thank you all the panelists, and thank you all the people that are listening in, tuning in to our session today. I really appreciate your being here for this session, and of course, I'd love to have you come and join us for subsequent sessions. My role today is, first of all, as everybody has told me, be brief so we can get to the real subject matter, but to be brief and to give you a little bit of a sense of what might be going on in this world of ours for the U.S. economy, most importantly, of course, and lots of little parts of the U.S. economy, things like inflation, employment, all very, very important to how we piece this all together. And I would be remiss if I didn't say one or two things about stock prices. When we ended 2019, we were asking the question, how much further could the current bull market, the longest in our history, the current economic recovery, expansion and longest in our history, back to 1890, how long could that continue? Well, that's obviously changed. And it's changed now, and we're asking the question, how long could the current bear market and the current economic recession go for? How long is the challenges that we all face in our businesses going to continue, and what can we do about it? Let me just give you a little bit of an idea of what I think essentially what we're looking at right now. First of all, I've looked at all of the bear markets that have been accompanied by recessions, all of the pandemics, all of the epidemics in our history, to try to see if I can learn anything from them that I could pass on to you, share with you, that give us a bit of a reference point. And the answer is, I've only been able to find one thing that's common to all of them. And I think it's pretty important just simply to say it, and that's that they all end. Every one of them, every pandemic, every epidemic, every bear market that's coming by a recession is very unique. They all have their own timeline. We can affect those timelines, and hopefully we will affect the timeline, the current timeline of the coronavirus, but nevertheless, they're all unique. So what I often look at is what 38 economists are currently saying about the US economy, both for 2020, 2021, and 2022. What is the consensus view? And then I also look very carefully at what's the average of the 10 lowest forecasts? What's the worst case? And if I were to summarize kind of what the current situation is, what we're looking at is we're looking at, let's call it just some bad news and not so bad news. The bad news is, of course, is that the US economy has now entered a recession. I would say we entered the recession in March, and it's going to be very, very, very significant in the current quarter, the second quarter of 2020. The current consensus forecast, my forecast as well, is that the economy is going to contract about 25% in the second quarter. We've got some very sensible forecasts that say it could be as much as 40%. That will make this by far the worst economic quarter, a quarter for our economy that we've had in our history. A close second, not so close second, is the first quarter of 1958, which was down 10%. This one looks like it's going to be down 25%, and a lot of it's going to be in the month of April. In the month of April, you'll see these numbers at the end of next week. The month of April, we're likely to post that we lost 20 million jobs during the month of April, and the unemployment rate increased from, say, 4.4% up to between 15 and 20%, and that's all in the month of April. So the second quarter, the quarter that we're in, the quarter that you're going to be looking at the numbers for, is going to be about as dismal as it could possibly get. That's the not so good news. The better news, or the somewhat good news, is that we're going to start to reopen the economy. It's going to be in a staggered by states, staggered by regions, staggered by companies, staggered by industries. But we're going to start to reopen the U.S. economy. So we're likely to see a bounce in the third quarter, a recovery, some recovery, economic recovery in both the third quarter and the fourth quarter this year. I put the numbers at 7.4% third quarter, something as high as maybe 7.9% in the fourth quarter, and ongoing recovery through 2021 and 2022. Having said that, even though we're going to get some sort of a bounce or recovery, this is going to go down as one of the worst years in our economic history. It's going to be number 5 behind 1930, 31, 32, and 1946. But so the economy will show for the year a contraction of about 3.4%, and we'll lose, when all is said and done, something between 9 and 10 million jobs this year. Not a good year. But the important thing I think to keep in mind is a recovery starting in the third and fourth quarter. Maybe it gets delayed to the first quarter or second quarter of 2021, but we'll start to see a recovery, or the trajectory will be right. The other thing I think I should mention is that this is obviously the recession is going to impact New York State, and it's also going to impact the Albany area, which gives us lots to talk about and a real challenge that lies ahead. In the case of Albany, I would say we could be experiencing or looking at anywhere between a loss of jobs in 2020 of 13,000 upwards to somewhere around 17,000. So we've got some real challenges as a community, and we really need to talk about them, and that's exactly what we're going to try to do today. A couple of other just small points, questions, answers to some questions that I get so frequently. What about inflation? Look, Hugh, come on, the money supply is increasing very significantly. Isn't that going to lead to much higher inflation? The answer to that question is maybe someday down the road, but not yet. You're going to see lower inflation in 2020 and 2021 than higher inflation. That's going to be another challenge. Deflation is the risk, not inflation. The second thing is, what's going to be the shape of the economic recovery? Is it going to be V-shaped, a very sharp recovery? You give us some pretty good numbers, third and fourth quarter, or is it going to be more gentle, a U-shaped recovery? The answer to that question, I think, is U-shaped, because the recovery in consumer spending, which of course is a big part of our economy, is going to be very slow. It's going to be hard to restore the balance sheets of consumers. It's going to take time to restore, most importantly, the confidence of consumers. And until that happens, we won't see a significant increase in consumer confidence. It's going to take time. to get this economy back to the levels that existed at the end of 2019. And when I say the economy, I mean output and also employment. And finally, just one word on stock prices, because I know you're all interested. I'm pretty encouraged by what I see. If we're going to have a recovery third, fourth quarter, maybe it gets delayed to the second quarter of 2021. The stock market will turn up in advance of that. My guess is, and it can only be a guess, is I think the stock market low will be seen roughly 10% below current levels, or in a worst case basis, somewhere about 16% below current levels. We've seen the worst, I think, of the decline. The average decline of bear markets, 38%. This one's already been 35%. It's just going to take a little bit more time before we get to the low. So tough quarter that we're going through. It's going to be followed by better quarters in both 2020 and 2021. Inflation's going to be lower, and I think in time, stock market's going to be just fine. So I think we're all going to come out of this just fine, but we need to roll our sleeves up and start answering some of these very tough challenges, questions that face us, and that's what Dan was talking about. And I'll turn it back to Dan so we can get on some of the substance, some of the real issues that concern us all. So thanks very much. Great to have you come with us, and look forward to you joining us in our future sessions.
Okay, Hugh, thank you so much. And just to reiterate, Hugh will be doing a little more in-depth next week. I'm going to turn it over to Casey Seiler, who is the editor of the Times-Union, and we're going to get into the meat of the issue of safety in the workplace. Casey?
Thanks, Dan, and thanks very much to Hugh. Hearing those numbers, it's a reminder that when somebody tells you, may you live in interesting times, it is a curse. With that, I would like to introduce our outstanding panel, starting off with Guy Maddalone, the founder and CEO of GTM Payroll Services, a Clifton Park firm with 3 decades of experience. GTM employs a team of 70 and processes more than $1 billion in payroll every year for more than 40,000 local employees. Guy is a past president of the Albany chapter of the Entrepreneurs Organization and an advisor to the Center of Innovation and Entrepreneurship at Siena College. We also have Kristen Stangle, a human resource advisor with GTM Payroll Services with 14 years of experience, consulting with businesses on HR compliant issues and best practices. Kristen earned an MBA from Union Graduate College and has her professional HR certification. And third, last but certainly not least, David Holtgrave, the Dean of the School of Public Health at UAlbany since March 2018. He is also a SUNY Empire Innovation Professor and a SUNY Distinguished Professor. He's a former professor and chair of the Department of Health, Behavior, and Society at the Johns Hopkins Bloomberg School of Public Health. I thank you all for being here for this important discussion. So let's get right to it. And our first topic, and I think I would probably pitch this to David Holtgrave first. What is the best way for a company to assess its own level of risk of infection and therefore come to the most comprehensive plan for a restart as workers return to the traditional workspace when their region's pause ends?
Well, thank you very much, Casey. And I'll start by really talking about the context in which businesses find themselves. And I think when we look at the public health context, we think about a few kind of gauges that we might want to look at. And one that's brand new over the last few days that I think is relevant to this discussion of reopening businesses is the state's use of antibody serosurveys that tell us what's the prevalence of coronavirus in our particular area. So for the state so far, they've done a few thousand tests, mainly in grocery stores and big box stores. And overall for the state, it implies that there's about 14.9% of people living in the state have antibodies to coronavirus, meaning that they've had infection with this virus and have hopefully cleared it. Now, we're not quite sure how long immunity lasts if you have it or how perfect that immunity is, but it's helpful to know how many people have had it. And I think one of the things I would do is think about breaking this out by the region where everyone finds their own business. So in Long Island, it's about 14.4%. In New York City, about 24.7%. And in Westchester and Rockford about 15.1%, and for the rest of the state, about 3.2% of people have had coronavirus previously. Here in the Hudson Valley, it's about 10.4%, and in Western New York, about 7.1%. And I think that is useful when businesses are thinking about reopening, because it gives us at least some early indication in our geographic area, what's the prevalence of coronavirus. And the opposite side of that, if we take 1 minus these percentages, it tells us how many people at our workplace might still be susceptible to coming down with coronavirus. And going into this kind of a reopening, you would either hope that that percentage was really low or high enough that it was like 50 or 60% that there might be some herd immunity. A really challenging place to balance is what we find ourselves now. If 10 to 20% of a population has this virus and about 80 to 90% are still susceptible, we really have to be careful in how we're doing our reopening and practicing social distancing and so on. And I know we'll get into that later, but Casey, those are just a couple of initial thoughts, sort of setting the public health context that each business finds themselves in.
So maybe throwing it to Kristen and to Guy, clearly a law firm would have a different level of risk than, for example, a factory where people are next to each other on the line. So do businesses need to be thinking about how they conduct their work in a very step-by-step process before they figure out how they can bring people back?
Yeah, I'm sorry, go ahead, Guy.
Go right ahead.
So the employers should do a risk assessment for sure, see how often employees are, how close they are to one another and their interaction with customers and with the public, and the amount of traffic that is in the workplace and even in different parts of the work building too. So that's something that the employer should do a risk assessment first, and then they can develop a plan right from there.
Yeah, I would add that it's definitely, a law firm is much different than a manufacturing facility. You know, certainly what type of business are you? Are you a construction firm? What's your interaction, not just with your employees that you have in your own facility or facilities, but also where does it extend with contractors, vendors? How about when customers are interacting? You know, where's our foot traffic? You know, can we follow that? You know, what's our touch points? What's our, you know, where's the possibility that people might, you know, congregate together that for longer periods of time, that we have to identify that, you know, we have to probably get some control around that.
So I guess I'd pitch this question probably first to David as well. What specific advice would you give to business leaders or business owners who are now kind of framing those best ways to open up once they kind of get the all clear from the state? And once again, the all clear probably won't be anything like an alarm going off. As we've heard, it's going to be, you know, the metaphors that we hear is that it's going to be a dimmer switch. It's going to be a phased reopening, that kind of thing. But what should they be telling people in terms of maintaining physical distance at work in a way that, of course, we've never comprehended it or thought about it before, and also monitoring workers' health on a regular, perhaps even daily basis when they're coming to work? You know, and should businesses expect that they will be able to check the temperatures of employees before they go into the office or the facility? And also the question of how should they go about keeping the workspace as sanitized as possible?
Those are all great questions, Casey. And I think given that there's so many novel challenges in front of us, I think it's helpful to just sort of keep one heuristic in mind. And that is really this virus is spread by droplet infection through coughing, sneezing, breathing deeply in somebody's direction, and maybe touching common surfaces. And everything that we're talking about is how to be as thorough and comprehensive and creative as we can to just disrupt that one thing. And it reminds me a little bit, like I've done HIV work for about 30 years, and about 25 years into it, I wrote a paper that just tried to remind the field that we're really only talking about one thing. Here's how HIV is transmitted, and if we can just focus on that. So everything is variations on that theme. And I think for us in the workplace, we can look for good summaries, things like from the White House reopening guidance has specific guidance for steps that employers should take. CDC has similar guidance for businesses and employers. And I think they all really revolve around four things. One is sort of the individual behavior change, like hand washing, wearing masks, wearing gloves, going home if you feel ill during the course of the day. Secondly is this whole area of environmental cleaning that you mentioned before. And I think the guidelines out there, both from CDC and New York State, are really clear and easy to access. And I think not only is there the issue of doing that kind of cleaning, but helping customers understand that it's going on. I think some of the auto dealerships have had amazing commercials where they show if you bring your car in to be serviced, how will it be disinfected both before and after it's been repaired? And it really gives a sense of comfort to the customer of what's happening. And third, I think it's the whole area, as you were saying, Casey, of physical distancing. Ideally, it would be great if everyone was 6 feet or more apart, but that may or may not be possible in the workplace, depending on what the particular kind of production is or what the kind of business is. And I think all these kinds of techniques are sort of compensatory with each other. The more we have to be close in a particular kind of business, the more we want to pay attention to masks and gloves and things like that. If it's not possible with customers to wear a mask, maybe we have to be more focused on physical distancing across a counter and so on. So all of these things can be complementary to each other. And the last thing I would say too is I think you're exactly right. The White House guidance suggests that we would take everyone's temperature almost on a daily basis. And I think that's going to become the new norm. We've seen that in some other countries like in South Korea and so on. And also testing is going to be an important issue. And I think eventually down the road, when antigen tests are developed, it might be that there'll be tests that can be administered right there in the workplace. But until that time, really, we're still in the era of diagnostic testing, and businesses would have to call the state hotline of 888-364-3065 and ask for a PIN number and send the employee to that drive-through test or that walk-up site to get a diagnostic test. So we need to see more in the way of testing availability to make it easier on businesses to do that piece.
Kristen, ahead of the formulation of those plans, what's the best way for businesses to communicate what they will eventually be to workers? In other words, just as we began this conversation, I got an email from the leadership of the Hearst Corporation talking about how each property was going to devise plans to welcome workers back on down the road when that becomes possible. When should businesses be communicating with their workers?
Employers should really be communicating with their employer group as soon as possible and well before that back to work date. They can continue to communicate in the manner they have since employees started to work from home or stop working when the business is shut down. The employer communication should really be proactive, consistent, and reassuring to the employees to make them feel comfortable and make sure that they are engaged with their company still. Employees really appreciate a proactive approach from the employer, and the transparency of a communication regarding the employer's plan to get back to work will really be appreciated by the employees. The communication should have introductory language, again, saying that the company is excited to get back to work and talk about the precautions that the company is taking, including disinfecting, social distancing measures, and screening employees when applicable and when possible, and the protocol in place to keep employees safe, work from home measures going forward if required, or if best based on the layout of the building and the workplace. Really keeping that communication proactive, consistent, reassuring to the employees so that they feel comfortable when they're coming back to work. Another thing that the employers will need to address in that communication is the accommodations that employees may need. Some employees are out of work and they have to stay out of work even when the business is open again because they might be watching their kids whose school has been closed for the school year, or they may have some other FFCRA qualifying leave reason to stay out of work. So accommodations are going to be necessary. Some employees who can go back to work, but maybe they're anxious about getting back to work, or maybe they have some other underlying reason for not going back to work, they should be introduced to the accommodation process too, because employees will appreciate understanding that there are avenues for them to take to address their concerns. And really just the underlying theme is the proactive, consistent, and reassuring tone of the messaging from the employers to the employees, early and often also.
Proactive, consistent, and reassuring. That those are definitely the watchwords there.
Yeah.
Just briefly, what is, you mentioned the FSCRA, what is that?
FFCRA is the Families First Corona Response Virus Act, and it consists of two parts, and employees can take sick pay if they themselves are sick or they have been quarantined by a government or a recommendation from a physician, or if their dependent is ill with COVID or they themselves have been diagnosed with COVID or quarantined, or if their child is out of school now or the daycare center is closed, so they need to be away from work to watch their kid. So FFCRA is something that the federal government started effective April 1st, and it does allow employees protected time away from work, and it is paid protected time.
So just to look at kind of one, that's a great analysis, to look at kind of one situation that managers might be encountering once we all do start to go back to work. If a worker can work from home, has been working from home, and wants to continue to do so, should managers let them do that? To kind of put it another way, when will it be okay to expect or potentially even oblige that specific category of workers? In other words, people who are not immunosuppressed, who could conceivably come back to work. When will it be okay for managers to say, no, we'd like to see you in the office?
All right. And it really does depend on the employee. Again, those employees who are out on FFCRA, that is an excused leave, and that should be an accommodation that the employers review and then approve, assuming that the circumstances stay the same. Employees may request accommodations if they have medical underlying issues, either physical or mental, and those are accommodations that through the Americans with Disabilities Act, the accommodation needs to go through an interactive process, so the employer reviews it and decides whether or not it's feasible. The sticky part is employees may request accommodations to stay home from work and they don't have an underlying issue. And that's when it goes to the decision makers of the company. HR is in the business to guide the decision makers, the CEOs of the company, to let them know what the laws are, what the HR best practices are, and provide any guidance. And then it's up to the decision makers of the company to look at that employee and look at the role, see, is it essential? Is the location of that employee central to the operation of the business? And what precedent do they want to set for the company?
This one I'll pitch out kind of to the whole group, but maybe Guy, if you want to weigh in first. What are kind of some of the workplace specific pitfalls that businesses might not be thinking about? I think we've mentioned the idea of kind of tricky physical spaces, such as perhaps the water cooler, the break room, and perhaps even bigger than that, a challenge not so much to physical health, but to kind of the mental or spiritual health of your business, morale challenges. Everyone is going through an unprecedented period of challenge and anxiety that we as a society just have really never experienced before, or at least not in roughly 90 years, with perhaps the notable exception of course World War II and perhaps 9/11. But this is it's a huge morale drag that is hanging over every worker, even those who are lucky enough to stay employed through this.
Absolutely right, Casey. Without a doubt, there's some real concerns. I would say that small businesses or business owners have enough on their hands so far with the fact that they're losing revenues. They're trying to keep their business intact. They're taking some PPP funds, trying to figure out how to get employees back on the payroll so that the funds can get forgiven. And now they're confronted with, how do we make our workplace a safe place to work, as well as keeping the morale up for the employees? So some of the pitfalls on the safety side, let's say that there's no COVID-19 symptoms that we're detecting. And we now have somebody who's come to the workplace who has something, they're carrying something, but yet we couldn't spot it with all the testing that we had done. Maybe the employees don't or forget to comply with the best practices that you've put forward as far as distancing, wiping behind them. You have customers come into the organization and they don't comply. Maybe there's a new spread in the community. Those are some of the things that, we can't control. We can somewhat influence them, but we can't totally control them. I think as far as the employees go, Kristen hit it on the head. Let's say they're anxious about returning to the work site. Maybe the PPE or the protective equipment that we've bought, they're uncomfortable wearing it. They might find it intrusive. Perhaps maybe they're worried that their personal health may be disclosed, or they're being tested in front of coworkers or superiors. Visitors who come in, they might feel that's intrusive and therefore, creates a little bit more of an issue. It makes the employee feel uncomfortable. They might be also looking at coworkers who are putting in for sick days and some of that work being shifted over to them. And now as a result, they are doing that work. And some at-risk employees are being granted work at home privileges versus others who are not. So therefore they don't think it's fair. So those are just some of the pitfalls that I'm seeing as I jot down on a quick list and thinking about all the clients that we're taking care of in this community.
I'd just like to note for anybody who is out there in the audience, if they have questions for any of the panelists, they can post them on as comments below this Facebook Live right now, and they'll be zapped to me, and we'll put them out. David Holgrave, back to you. Albany is, of course, a large and influential institution, but it's also a workplace that is, undergoing many of the same stresses, perhaps more than some in our community. Do you notice that as well as a manager, as well as an expert and an academic?
No, thank you, Casey. No, we really do. And I think, three things I would say. One is regarding risk communication with faculty, students, and staff. I worked at CDC in the 1990s, and one of the things we said a lot was, what do we think and what do we know? And that phrasing has never been more relevant as it is now in COVID-19. I think people really want to hear a lot of communication. They want to know what is it that we know that's factually based? What are the policies like that are going to unfold? But also, where do we have doubts, or where do we have things that are just uncertain, either in the scientific realm or the public health realm or the business sphere? And just being able to say, what do we think and what do we know, can be really reassuring, I think. The other thing is a business too. I think it's important to think about what happens if there's waves in the fall. Dr. Fauci from NIH talks about it seems likely that coronavirus will be with us in the fall. And the question is it going to be a little ripple in the fall, or is it going to be another wave in the fall? And as we think about reopening, whether it's schools or other kinds of businesses, I think using some of that time of reopening to prepare for another wave, whether it's a small one or a severe one. And I think that will help us at the university. And then also, I think, certainly there are some kinds of businesses where some people live in that setting. So we saw what has happened with nursing homes and what has happened with cruise ships. When we get back to on-campus learning, of course, the dormitories are really an important issue for us in the university, and thinking about how to make that living space really a good, safe space is important. And I have every confidence that we'll be able to do that. We have a great team that's working on that already and thinking through those challenges. But those are just a few for us. And the last thing I would mention is I think that how we do research is going to change as a business as well, too. There have been no scientific conferences for several months now. All the spring conferences were canceled. And I think to many people's surprise, we found we can communicate with each other pretty well, actually, and we can accommodate a lot of that business and do so in different methodologies, and in some cases even more efficiently than if we all were going to fly to Minneapolis for a week or something. And I think that's going to change how we conduct research in the future as well, maybe for the better in the new normal.
Kristen, David mentioned the possibility of a future surge, or perhaps even, I think it's fair to say that there could be surges, either small or large, in the future. Whose responsibility within a business, or who should take responsibility within a business, to monitor day by day, potentially even hour by hour, the possibility that a business exists in a zone, geographic or epidemiological, that could be experiencing a surge of new cases? Does that fall on the HR department? Do companies need to designate somebody to essentially be a coronavirus data monitor?
Depending on the size of the company and the resources available, there can be a chief health officer, or it could be the director of human resources. It should be one dedicated person or one dedicated team that understands confidentiality and is at a level in the company when they have the opportunity and the availability to stay on top of what's happening with COVID-19 and the CDC guidelines too. Staying current with what the CDC is proposing guideline-wise to stay safe and where the surges might be or might be upcoming too. So it really is the leaders of the company and a designated individual who understands that, the COVID-19 is a priority and staying on top of that.
It's an interesting point that Kristen's bringing up. A wellness deputy is probably a whole new position in so many companies. And to speak about some of the businesses that we take care of that have less than 60 employees, they don't have an HR manager. In some businesses, it's just the owner. It's just the owner and their spouse, or it's the office manager. And so obviously that brings a whole slew of concerns about testing and monitoring and personal privacy and so forth. But, I think that maybe an opportunity for a new business who hasn't been thought of yet is perhaps maybe these wellness deputies that are going to help service the small business community. I think as far as our business goes, with 70 employees in the local area, we are likely going to have to bring somebody else in and then also have somebody backfill that person. So we have redundancy in that position.
If you all don't mind, we started a little bit late, so I'm going to go a little bit past 10 o'clock if that's all right by you. We are getting some very good questions in from the folks who are viewing, and here's one that I think is a fair one. Will businesses legally be able to take employees' temperatures on a daily basis? We mentioned that before.
I've got that one. Yep, the answer is yes. The Equal Employment Opportunity Commission, in working with the ADA, has said that employers can take employees' temperatures on a daily basis, because going to the workplace, if you are infected, that is a danger to your coworkers.
That's federal. That's not state. It's federal, correct?
Yes.
Here's another question. How will parents balance going back to work when they're schooling their kids and the schools are closed? Will businesses be flexible to this reality? And I guess since we are not that far away from summer, although it doesn't always feel that way when it's snowing here in the capital region, I would say that goes for summer camps too. We're reading stories, and I know that I've spoken to parents who fully expected that their kids would be occupied for a set number of weeks with summer camps, summer programs. Those have almost all of them have now been canceled.
Yep. Employers are going to have to look at their PTO policies and their absence policies and their paid leave policies and work flexibility into them if they want to keep those employees that can either work part-time or work remotely if their kids continue to be out of school or they don't have that coverage. If the day camps are not open and daycare is not open, the employers are going to have to work with those employees to really reach that balance.
And I think it also, again, goes to the type of business that you're in. It's much easier for a law firm, to have a policy like that than maybe a manufacturing plant where someone's working on the line. So it certainly makes it, feels good that employers could all offer this time, this flexibility, but it really goes down to the critical operation of the business and the role that that person's playing in it and whether or not they are needed in order to produce the good out the door.
Here's another question. Any advice on how to manage different rules across the region, local governments and schools, especially in regards to requiring PPE and the taking of temperature?
Well, maybe I'll start. I think one issue is whether or not there's partnerships that different businesses could form. I think, for instance, just at Albany, we were asked to partner with the Department of Health on a number of different projects. And I'm sort of mentioning this more as a managerial issue at the moment rather than a research issue. And I think one of the things that really struck me was, given the challenges for COVID-19, there were projects that the state alone, the Department of Health couldn't have achieved, and we at Albany couldn't have achieved. But when we put the partnership together, we could actually do a lot of things very, very quickly that wasn't possible. And I think to Guy's great point about like a wellness deputy, thinking about whether each business needs to have their own wellness deputy or whether there's partnerships that could be formed in some way where people are serving roles across different entities as well. So those are just a couple of thoughts.
Yeah, you know, that I would follow up too on the PPE stuff. I mean, our business is in Saratoga County. There's been some really terrific Saratoga County based companies that have started to develop PPE equipment. Hand sanitizer is an example in the early days of this, where if you're an essential business like GTM is, we were able to go and pick up hand sanitizer and have it in our organization. So I think a lot of the businesses that are local, that are trying to take care of others in the community, that are able to help gather this information, make these materials, is certainly going to be very helpful in the small business community. Things like gloves and goggles and face shields. It depends on the type of business that you're in, if you need them. Gowns, sneeze guards, you know, all these types of things. But if we can, as a small business community, come together and try and figure out how to source that the best way, most efficient way, so we can get access to it. And then the other side of it is, do you actually need it in your operation? That's probably what your plan will tell you.
What are some other new jobs that could be created by this, at least temporarily? There's, you know, the person who takes the temperature at the front door before anybody goes into work. You could create, probably, if you're a large enough organization, a full-time post of, you know, sanitization procurement officer almost. What are the other roles that businesses are going to have to designate or create in addition to the ones that we've already mentioned, do you think?
Well, I think one right off the bat would be, you know, many companies, again, small companies, will outsource janitorial services. That we might have a movement where we go back and employ a janitorial team on the company's payroll. So it's more of a frequent, more rigorous cleaning throughout the day, opposed to, you know, an outsourced every several nights or infrequent basis. Certainly, we don't know how this is going to be complied with or who's going to be supervising it. But if there's inspections that have to take place, you're probably going to have to expand your human resource department to be prepared for, you know, any type of government agency that wants to inspect your property. Those are just two that I'm thinking off the bat.
Mm-hmm.
And I would maybe add to that too. I think one thing besides testing, which is going to roll out, and there'll be, I think, whole additional roles, almost jobs around getting the testing up. And we were talking now about millions and millions of tests a week in the United States, which is just an enormous undertaking. But also contact tracing. If we want to, in areas with really low prevalence, contain a few cases here and a few cases there, not only do you have to do testing, but you need to be able to follow up and say, who has that person been exposed to before? And there's been some estimates that in the US, we need 100 to 300,000 new jobs for people to do contact tracing. And I don't know exactly what the magic number is, but clearly it's almost an army of people to do that kind of work. And it's interesting to me, in the White House guidelines for employers, they say right at the front of reopening, one of the responsibilities, and to my mind, one of the most difficult for businesses, is to develop and implement procedures for workforce contact tracing following an employee testing positive for COVID-19. And thinking about how to stand up that effort and so on might be another kind of job that's going to be necessary.
That's a very good point. And I wonder, what type of access will the businesses have to whatever the official, you know, either local or state or what have you, contact tracing investigation is going to be? In other words, would a business have to essentially have its own in-house contact tracing investigation that might run in parallel with kind of the more official governmental investigation, or will the government or the healthcare agency be able to share that data with the business, which of course has a key interest in keeping its people safe and having that data? Or will the government investigators essentially say, we're sharing it with the people who may have been in contact with the person who tests positive, but we're not going to share it with the business or the organization that they work for?
Well, I'll start, and I think Kristen and Guy will probably want to add to this from an HR point of view. I think the traditional public health approach has been like the county health department would say, we're going to do the contact tracing. We'll notify people who may have been exposed and tell the people who may have been exposed just enough so that they know that they need to go and get a test and so on. And normally that information would kind of go around the employer, would kind of go from the health department to the person who was potentially exposed. But I don't know, Kristen and Guy, if you have other HR thoughts about this issue.
So employers do need to remember to respect their employees' confidentiality and ensure that employees that their privacy will be respected. When somebody is exposed, they can tell the local Department of Health to let them know to maybe start the process. And I think that the local Department of Health and the employer will work together, maybe tag team. The employer may provide some information and prep the employee on the type of questions that they're going to need to answer and what they should be thinking about. But I think it will be on a more consistent measure if it is a county level type investigation that happens interview-wise, and it also takes any liability away from the employer for intruding on the employee's privacy. Also, we don't want coworkers to know who's been infected because we don't want them to start to treat that individual differently.
I'd just like to remind folks that if they have questions, they can post them underneath either the YouTube stream if they're watching there or on our Facebook Live page. And here's a question that just came in. What lessons were learned after 9/11 and the 2008-9 economic meltdown that can be applied to a post-COVID shutdown plan?
Well, I can say that we certainly were in business for 9/11, and we were certainly in business in 2008. The issues with 9/11, I think, was just a degree of uncertainty. Although it was an event that was over, potentially that we maybe would have had another event. Just the uncertainty of where to go forward, how much to invest in the business, how to operate with a certain efficiency. 2008 was definitely a retraction of the business. And I think what we found here, at least what we're finding since we've been up and running an essential business for 6 weeks now, is that we're taking an attitude of let's see what happens, because there's no clear idea of when business is going to get back to normal. However, with taking the attitude of let's see what's going to happen, we've scaled back the expenses, the overhead. Many businesses have stopped paying either overtime to workers, asked management team or salary groups to take a reduction in pay. They're starting to plan what second quarter would look like. Many businesses, if they're going to have any type of loss, are trying to mitigate it to a small amount. And then what they're looking at is how does third quarter look and what further reductions need to be taken care of if the revenue doesn't come back into the business.
Guy, question for you. The figure of the boss is not always loved in American culture, but at this time when workers are hurting, when mid-level managers are hurting and feeling stress, speak, if you could, to kind of what business owners and managers need to think about in terms of kind of their own mental health, where they are dealing with levels of stress, economic, you name it, right now. Everyone needs to do self-care during a period like this, right?
Absolutely. And I think what's really important is that most entrepreneurs and business owners are optimistic people. They always see that glass is half full, and they need to keep that in mind when they're going after this tackling this problem. I think Hugh said it right. And when he said that everything will come to an end, there's always been an end. And he's right, this will end. So you have to set the tone and effectively, continuously be an optimist. However, you need to be a realist. And with that, you need to be transparent and communicate to your teams all the facts, what's happening. They know, they watching their friends being laid off, waiting 6 weeks for unemployment to start paying, waiting for PPP funds to come in. They understand that's what's real. So to be transparent, to be consistent with the communication is really, really vital. But also,
Oh, Guy might have, oh, go ahead. I'm sorry, Guy, you got cut off there for about the last 10 seconds.
so that this will be over, and that we will all make it, and to keep the faith.
All right. I think that's a perfect way to bring it back around to where Hugh began this discussion. I'd very much like to thank our panelists, Guy Maddalone, Kristen Stangle, and David Holgrave for taking part in this discussion. I'd like to thank everybody who listened in and the folks who submitted questions as well. And with that, I'll hand it back over to Dan for a farewell and an invitation to our next session.
Thank you, Casey, and thank you for your expert job in moderating the panel. A lot of good information, a lot of good ideas, but I'm going to finish the way I began, which is to say there's no playbook for this. This is unique in many ways. And I think if we can continue to be optimistic, as Guy said, it will end, as Hugh said. And if we can continue to share ideas and solutions and challenges, we'll all get through this together. And I think better than if we all try to go this alone. So let me sign off by saying we have a session scheduled for next Tuesday, which is May 5th, same time, 9 o'clock. We'll try not to be late. And we're going to talk about access to capital. And that includes capital from the government, capital from banks, private sources of capital. And Hugh will provide us a little more in-depth look on his forecast for the economy. So sorry again for the little delay. Thank you for joining us. Hope you found it helpful, and go on and have productive work days. Thank you.